through issues, but I wanted to publicly come and kind of answer many of your questions, and I want to thank Councilwoman Fiore for making this possible this morning. As you know, on the last meeting you had a lot of questions, and I felt like I could climb through the screen and answer them all for you, but today here I am to answer all those questions. I also brought with me Chief Steinbeck, who leads the MAC for all of us across the region. And so I wanted to start with where we've been, how we got to where we are today, and what the future is, and how do we do it together? Because we do have to be in this together as a region in order for us to rise to the top. So Mayor, you know, when we started this in March, there were some hard conversations that we had with our state officials because we didn't get a lot of input. And we were frustrated, right? Because we were turning on a dime, making a lot of moves, and we were just trying to navigate the waters. And today we're still navigating the waters when it comes to our children and education. We worked through a lot of those issues in March. I feel like we've been doing this for at least a year, but it's really only about 5.5 months. And we started making progress. I volunteered, which I'm probably crazy for doing, at this point, but I volunteered on behalf of the Southern Nevada region to work with the state to write the guidance to get things open, because we all agreed that at some point we had to start moving forward economically, or we were just going to stay in a funk, and that was not going to work for anybody. So I agreed to do that, not realizing the amount of time and the hours that it takes, amount of expertise that I had to go and find, because I'm not expert on any of those, but I do have some real life experience, which I felt sometimes that got forgotten, right? So when you're putting in guidelines on how food service should operate, you should absolutely have some real life experience on that, because it sounds great to say that you're not going to leave your creamers out for 2 minutes, but in reality, if your restaurant's busy, you got to be able to do that. So I took a lot of time. I work on those guidance. I reach out to 10 other states with my NACO hat, and I ask what's working in their states, what's not working. And then we work with the health district. So the health district, who in all fairness is truly leading the charge, and he's a partner to allow all of us to move forward. So we work with the health district, and then I submit them to the LEAP committee, which is made up of JJ Gokachia, who represents the rural areas, because what works in Southern Nevada for sure does not always work in the rural areas. Commissioner Lucy, who represents Washoe, because Washoe and Clark are very different in a lot of ways. And then we have Dagny Stapleton, who is the NACO representative, who works with Wesley, who is the League of Cities representative. Then we have OSHA, because what we didn't want is for everybody, all agencies to be doing their own thing and not doing anything well and giving mixed messages. So, and we have OSHA, and we have, which is Terry Reynolds, and we have Mike Brown and Michael Brown, which is Economic Development, and then we have Scott Gillis. And amongst us, sometimes we don't agree, but we try to do what's in the best interest. So we've been doing that for a long time, and I'm thankful. One night I called the chamber. So, and the chamber spent their entire weekend, because I'm no typist by any means, helping me format it and put it all together. So that's how we got to phase 1. We also agreed on phase 1 that we did not want to open on Cinco de Mayo weekend, because it could be a rough weekend for all of us, and everybody would just be so excited to get out and about that they would make mistakes, and we were not trying to go backwards. So if you remember at that time, we were at a 5.5–6% positivity rate, and we were ramping up our testing, which was required by the federal government at that time. So we knew that as long as we stayed below 10%, 10% is the magic number that Vice President Pence and the task force put out, that we have to stay below in order to stay open and do many things. So then we moved to open the casinos, and again, not on Memorial Day weekend, because it didn't make sense, because we knew what would happen. And we worked tirelessly across the state to help people understand what you can do. The reason the guidance is a little bit broad is because it doesn't work in every case, right? I learned a lot about eyebrow threading, never did it in my life, didn't know what it was, but why couldn't they be open, but the hair salon could be open. I learned that some places call it a tavern, some places call it a bar, so it has been an education for me. I feel like the jack of all trades at this point, but I basically know what 250,000 businesses in Nevada do so that we can work with them. So at the MAC, we asked, a regional issue, what businesses have been left behind, what was forgotten. We found a lot of things. We found paint and wine. Well, how come that didn't fall into a category? And then we said it really does, because it's a retail category. So there's not specific industry guidance for all of it. So we put indoor venues so that we could put it out there so that if you are an indoor venue, here's the guidance that you should follow. So we started testing quite a bit, and I'm going to have Chief Steinbeck specifically talk about the testing because that's a big piece of where we go. So phase 2, things are moving along. Holy smokes, all of a sudden, FEMA comes to town, Arizona is elevated. They come to town and they say, you got to close everything. And I'm like, whoa, time out. We're not closing anything until we have a discussion. So we had a discussion with FEMA. And as I said on the MAC call, I spent 38 minutes arguing with the governor on where's the data, can we slow down just a minute, but FEMA was adamant that we closed things. And so I argued the case to keep pools open, I argued the case to keep gyms open, but on the White House document that is released every single week, it says here's the things that must close. So FEMA came, there was 30, 40 of us in the meeting, and I insert myself honestly in every single meeting because I want to know what everybody's saying. So I could take this big puzzle and put it all back together. So any of you are welcome to do that anytime, but I insert myself. So if I call him and he says, I'm getting on a conference call, I'm like, what is it about? Can I join? And of course he says yes, whether it's good or bad, because I ask a lot of questions. But we met with FEMA, and we were actually able to walk them through our process. So they had no idea of the surge center that we had planned. They had no idea of all of the marketing things that we were doing. They had no idea of our hospital capacity. And so they felt much more comfortable when they left. But we did learn some things along the way. But we were required at that time to submit a report to the governor as well as the White House. And so as you see, it's about 900 pages of all different documents. And I encourage anybody to read it because if you look around the country, our document is very good. We are doing a lot of things great, right? And that's because as a region, we are working together. However, every single week, I get the same report from the White House that says I should be doing all these things. So we approached the governor about taking a different approach because where's the data that shows that gyms are a problem in our states? They may be, by all means, in other states, and that's one of the things we found along the way is cosmetology. We were the second state in the country to open. And the number one reason is because we had a cosmetology licensing board, and that cosmetology licensing board had better standards than 30 other states out there. So that's how we were justifiable to open many things. We asked for a different approach because we're not trying to do winners and losers. I am not for sure because I can't keep track of winners and losers. What is the most consistent way that we can move forward? So the mitigation plan was brought up, something that Colorado's doing, something that Ohio's doing. So we put together a Nevada-style mitigation so that we could bring those things to the forefront and have public comment and see what the data is to tell us. What we know today is when FEMA came, we were at 19% high. So we went from the very low of 5% to 19% of our folks testing positive. We know that there are 7 zip codes in particular where there is a lot of positive rates. So we, on a regional basis, Clark County, hired a Hispanic marketing firm, and Councilwoman Diaz has been helpful on that, to go out and to educate them why at their grocery stores they need to wear a mask, why at their grocery stores they need to enforce social distancing. So today we're at, is it 13%? So we're at about 13.6%. So we've dropped that in 4 weeks. So social distance has worked. The masks have worked, especially in some areas where there was no compliance whatsoever. And I get it. I'm just trying to find the consistency, because as an economy, regionally, we got to move forward. We have to figure out how to do that safely. We have to be able to tell the world that we're doing it safely. So we invested, so we've been highly concentrated on those areas, and which is why we got the grant for the testing. So I know a lot of people are mad about more testing means higher positives, and that is not true. The stance that we've taken from day one, let's get to the source so that we have a better fall season than everybody else. We have overcome everybody. Everybody said we would set up our surge center. Everybody said that we would run out of hospital capacity. I can tell you the dates they told me that it was going to happen, and we've exceeded that because we are working as a region together. The one thing that I'm asking all cities to do is for us to work collaboratively on a comprehensive business enforcement plan, because it is all over the board across the valley, and it's all over the board on whose authority is what. And I know I heard you say that, yes, we did not stand up 60 ambassadors, and those 60 ambassadors were phenomenal for the month that you guys had them. We did not do that. We took a different approach. We created strike teams with our business licensing and our code enforcement. So everybody did something a little bit different, but all working towards the same goal. I've reached out to hundreds of businesses saying, hey, we got to show that we got to get rid of the bad actors, because there's plenty of bad actors out there, but why should the rest of us good actors be penalized? But if the bad actors, and I'm going to call out one business, for instance, last Thursday, 1401 South Main, they had a party of 300 people, live DJ, going on about their business for about 5 hours, no social distancing, no masks, but those folks live in our community, and if they continue to help the spread, that hurts the rest of us that are doing well. So that's why we're asking for a comprehensive plan for everybody. So today we're making huge progress. We had a MAC call, which is a regional policy decision, and we walked through for 3.5 hours on what everybody could give to ensure the state that we could manage any problems that there were if they came about. And so we spent 3 hours on that, and a lot of it was business enforcement. A lot of it was some education, but we've been educating for a while, and the good businesses, they don't need any more education. They just want to get open. But the bad businesses, I'm not sure how much education they can get, but maybe a fine makes sense, right? So trust me, I went after the rave that was in my own district that had 1,000 people, to where we knocked on his door and said, hey, Bella, you can't be doing this because we have no contact tracing. We have no way to do to follow that source. So where we're at this week, again, we will be submitting, as we do every week, to the mitigation team, and we're asking, and if you heard me yesterday at my own meeting, I said we're asking for our own autonomy, because we can manage it, and I promise we will all work together as a region, and I need you to be my partner in that so that we can do that moving forward. I need to go after the bad actors that are making it hard for the rest of us. I need to be able to open some convention business in a phased-in approach. I'd like to open up some churches. For the life of me, I can't understand why our children cannot play sports, except that they're spectators, right? So, okay, we'll take the spectators out if that's the case, but they're going to Utah, they're going to California, they're going to Arizona, let's keep them home. But I can't make all those arguments if I can't say that everybody's on the same page. And I want to just, and I'm not asking for anything today except that you guys look at a comprehensive business enforcement people where we can go after the bad actors, And we can go together and we can move forward in our community, because it's now September 1, and we have to secure many of the convention business, which is well, and you, Councilwoman Fiore and Mayor Goodman, you know that more than anything. There's about $500 million on the books that we want to secure, that people can come, but can they come in a safe way? And I think we could do it. We could write the guidance ourselves with our health district, because our health district, we are fortunate, and Southern Nevada has been phenomenal. And I can't say that across the state, right? He's been lockstep with us. What do we need to do? How do we follow? What are we doing? I know that there's some angst, and it's ironic that the CDC came out and said, don't test anybody unless they have symptoms. I'm going to turn that over to Chief Steinbeck to talk about where we got the grant, and it came out on the same day, but we're already into it, and the difference if we just test the asymptomatics versus the positive. So, Chief Steinbeck?
Yes, ma'am. Thank you, Mayor. Thank you, Council. Appreciate this opportunity today. Certainly around the testing, I've worked with many of you to try to get additional testing in your districts, into the city, and also throughout the county. Sorry, the mask, like many of you, it fogs up my glasses there, so I'll have to take them off. But we have, since the beginning of this, of course, when we had 40 tests a day, and it was such a difficult decision on who would get a test and who wouldn't get a test, to where we are today with our incredible capacity that we have at UMC, or increased capacity that we have at the Southern Nevada Health District, with the strike teams that we can put out into certain neighborhoods. But there's been an outcry for more and more testing. Some people will call us and say that they can't go to work until they get a test, or until they got a couple of tests that showed, because of the changes in the CDC guidance. And for us to be able to say, you know, we wanted to be able to tell them exactly where they could get a test, get it quickly, and get their questions answered, so they could either isolate and keep those loved ones and the rest of the community safe, or go back to work and support their families. So working with that, certainly when FEMA came, as the Chairwoman Kirkpatrick spoke of, they came with some doom and gloom there for a little while. And we said, no, we're not there. We're not where you're saying we are. We are in a much better position than what you're saying, but we do need increased testing capacity. And some of that was, some of the lag in our testing capacity was everything from lab technicians, but into quite a bit of it was the availability of the products and the testing mediums. But we asked for Health and Human Services to bring us additional testing capacity, which we were awarded, and which started on the 31st of August and goes through to September 18th. That's 60,000 additional tests that's available to this community. We are hopeful that that will help some of the criteria that the state is utilizing right now to measure us, improve that, and let us move off of the list that adds additional restrictions to us. We don't know if that'll be the case, of course, but it's our best shot. So this is completely free testing. We have it opened up at the Texas, we have it opened up at the Fiesta, and we have it opened up at Sam Boyd Stadium. From 6 to 2 Monday through Friday. That's in addition to our UMC testing that is at Cashman, and thank you so much for that, and the city was wonderful in helping us get that up and running, and that will continue and is uninterrupted, and that we also have at UNLV. So we want to make sure that everybody that needs a test, for whatever reason it is, whether they have symptoms or they have an employer that's insisting on it, or they're just scared, whatever reason it is, that we were able to fulfill that requirement and try to make it as available. And also, we had looked at places like Florida and Texas where there were 6-hour, 8-hour waits for testing, and we wanted to make sure we were much better than that. I can tell you right now, if you drive to any of the sites that I just mentioned, at this moment, you're looking at about 5 to 10 minutes. And you're in and you're out, and you've got your test. We've also got the turnaround times. The UMC times are incredible now. They are at, normally a day, maybe two. The additional testing that the federal government has provided us goes out of state. It's taking 3 days, maybe a little bit more to come back right now. But we've only got this surge of testing for this time. That's why we've had such a increased media push and pushed out the information in any possible way because of the desperate plea that we've had from your constituents, from her constituents, from so many people here in the valley to, hey, I need to have a test available. And then, of course, all of that is, we're working every day for the life safety, but also the economic viability. I don't want to hear, it just crushes me like it crushes all of you for the people that are losing their businesses that haven't worked since March. Those are heartbreaking stories, and if we can get, put whatever it is that we can put forward to assist in getting that back open, that's what we're doing. I want to congratulate your emergency management and business licensing for working with us on the plan moving forward that we have had so far. And I know that I know already that we'll get that same cooperation moving forward from here because we got to get all of us back to work.
So, Mayor, and I just want to add a couple of things. So if you remember in the beginning, we were only able to test 40 folks a day. And so I have a dual role because one, I sit on the LEAP, two, and I sit on the MAC, I sit on the health district. So I wear a lot of different hats, and I signed up for none of them, to be honest. So 2020 was supposed to be a nice, easy year for me, but it's been a hard year, but we are resilient and we can get through it. So in the beginning, we did not wait for the federal government to bring testing for us because we heard across the country that was the big problem. So Clark County was told by the state that, hey, we got our own CARES money, you got to pay for it. So we have been footing the bill since day one. So but we invested wisely. So we invested in UMC so that we could have a state-of-the-art research piece for the long term, but for the short term, we could move a lot of these things. Recently, we've been able to push the state to give $19 million additional to the health district so that we could get those backlogs, because people were frustrated, 5 days you have to wait for testing, but we had a workforce shortage, and so we were able to get $19 million from the federal government pushed through the state to get that backlog to help, and so now we're in a really good spot on turning around our timeframes. So we're always trying to be less than 3 days, which is one of the things that the health district, that the state and the national folks look at. We also were able to be successful and to get $44 million for testing from the feds. And trust me, I call our congressional delegation every single day. I spoke to 3 of them today. What are you doing for Nevada? And I give them a list of everything that we need. We were able to get those dollars, and the caveat to those dollars said that we have to continue testing our most vulnerable populations, which is our nursing homes, and the homeless for well into the end of next year, as well as people that have HIV, and so there are some caveats, so that will be going on for the long term, so we need to make sure that. So we are at the county pushing on behalf of the Southern Nevada region. And Mayor, you know me, I'm pretty loud when I need to be, and sometimes I say bad words when I have to, but for the most part, I am pushing hard everybody to work together. So if we could please stay together as a region, that is going to be our best interest to get out of this. So that's my public comment, very long, appreciate, happy to answer any questions. I feel like I know all this by heart, so. I'm a resource.
You don't sleep, and we're so grateful for everything
I don't sleep.
you've done and your years in the legislature, your leadership there. You're a remarkable woman and a remarkable resident of this community, and I just know that we all appreciate everything that you do all the time and taking this on. And sir, you really also, with everything that you've been orchestrating, and then everybody on your teams. So, there's so many things I think that we could each say and question. I'm going to ask our council if they wish to, but I think the conversations really could go on for days and days and days. And so while each community and each individual is unique as each person who is homeless, or each person is who right now is out of a job or looking at their last 20 cents, trying to support their family, and we look at the biggest question I get all the time is, I've been tested a month ago. I was negative. How often will the county and city and communities test me again? I am not sure that I don't need repeated testing. So while we're doing a first test for everybody, I'm sure scientists, and no matter which side of the fence you're on, each group of scientists has a different opinion. So we are as variable as that. We operate nonprofit for all, and non-politically for all of our people. So the main thing is to know the differences of people, do the best that we can, obviously work together. And knowing, having been at FEMA and taken that training years ago, realize how critical it is that everybody do their part. But data changes, data's manipulated, the rumors of hospitals having variable reports to qualify for CARES money, you know all of this. So we're in something that's so much bigger, and the one thing I do want to say right from the onset in March, mid-March, we weren't broken. We would not have created this community had we been a place that repeatedly had huge problems with disease. And people who got the flu, and we're moving into flu season again, which will further complicate testing and everything else. We never shut down for the flu. And so what we have done economically and psychologically to every human being that lives here, put this additional stress on them based on what we believe is truth and accuracy, but we won't know till it's done. And there is, you get diagnosed and you have a positive test, we can't give you anything to make sure you're not going to get it and have active problems from it. Or give it to somebody else. We don't have any prevention, and still we don't have a cure. And so we know that people don't even take the flu shot. So once we have that vaccine, are people going to want to take it? And then what are we going to do? Put a mark on everybody because I tested positive, so everybody will say, don't go near that person because they tested positive, and I don't want to be near them. This is something that can really get out of hand. And so I'm going to ask for input. Your days are so incredibly full. And we're all in here because we love Las Vegas, we love Nevada, and really want to do our part. But it's going to be so variable all the time. Every day something changes. And as personnel and communication breaks down, which is the big thing, the communication, to be on the same page, or at least have the plan. That was what was wrong with all of this. There was never a plan. Just shut down. And you can't do that. You have to have a plan and a procedure to get through the plan, but be ready to be variable through it all every single day. I'm sure you get new communication because you're trying to feel so much. We are so grateful, and I can assure you, at least for this person, this resident, that anything that I personally can do, and certainly as mayor of Las Vegas, my passion is for this city. Recognized once again as one of the most diverse cities in the entire country, if not in the world. And we all pull together, and we have that also on our plate. But the people that live here and love it, that are of diverse backgrounds, races, religions, we're a family here, and we need to keep pulling together and keep outsiders out. Don't get off the boat on helping us with this pandemic. So at that point, because I already took too much time, I want to thank you both so much for this. I will take the next at least 88 hours reading what you've handed out. So comments, let's have comments, and I'm sorry I went so long. Thank you. And I just do want to say, because we're
I'm here all day for you. I cleared my schedule. The county's running fine. I'm here all day.
But
for
I
you.
just want to say, in deference to all of this, all of us, when we get up and move around, we have our masks, we are 6 feet apart. We have always, at City Council, operated that way, but you can see the distancing and everything that we do. So much like at a restaurant, you sit down, take off your mask. The moment you stand up and walk somewhere, put the mask back on.
Mayor, I actively eat, drink, and smoke so I could keep moving myself.
No, the smoking, and I
See
was
how
going to
white it
ask
is?
you that. How do you smoke through that?
He's given me till January.
Then we're going to get her off the cigarettes.
Okay.
Councilman, please.
Thank you, Madam Mayor. One, I thank you, Commissioner, for coming out and speaking with us. I also see Commissioner Weekly is here, so thank you for being here as well, Commissioner. I'm in 100% agreement with you. We have to come together across our jurisdictions in order to work to combat this virus. It is far from over, even though our numbers are fluctuating back and forth, but it's only by the work of the citizens of taking it seriously and wearing a mask and washing your hands and being 6 feet apart that we're able to make this virus do its best to mitigate. And we do have to work together. The residents that we all serve have no clue and don't care if it's county, city, Henderson, North Las Vegas, Vegas. They don't care. They want us all to work together in order to make sure that we get this down. This past week, I've been in conversations with the Fremont Street Experience folks, as well as a number of owners of casinos in downtown Las Vegas, and they're trying to get their bars open again. They want to follow the rules. They want to do what they can to get people back into the facilities in a responsible manner, but only by us working together is that going to happen. It's just that simple. And so in order for them to get open, then we all have to come together. I'm partners in a restaurant, which is on the Strip, and I was there last night, and our big bars are closed. And we're coming into the weekend, we're coming into Labor Day weekend, things are moving in a good direction. But we are not going to get there if we don't work together. So from my personal standpoint, I am 100% behind you. I thought that our ambassador program was a great step that our city manager put in place in order to just help people get compliant upon their businesses. And so I just can't stress to you how much I am in support of what we are doing, and whatever I can do on my end to help out, then please let me know. Thank you.
Thank you, Councilman.
Thank
other
you,
comments?
Councilman Kerr. I appreciate exactly what you said. Sorry, I just wanted to respond to it, sir. Just, we're on the exact same page. Those industries, like the ones that you just described, they're coming up with solutions. They're coming up with ways that, hey, we can be as safe as another place. Please get us open. And as we work together and move forward as one voice for those people, that's how we'll be the most effective. So really look forward to working with you more on that, sir. Thank you.
Councilwoman Fiore?
Thank you. Thank you so much, Commissioner and Fire Chief, for coming out and giving us this regional approach. This was the thing that I was upset about, that we were doing something, off the cusp when the Clark County and Henderson and North Las Vegas and Boulder didn't have these ambassadors. I personally still am not in agreement with the ambassador program. But here's the thing, this changes every 5 minutes, and daily we recognize the doom and gloom instead of the positiveness, right? CDC, the same time you guys got the 19 million, they said, okay, don't test unless, people have symptoms, okay? So when we look at that, and so we take some direction from CDC, and then we take some not direction from CDC, because it changes every 5 minutes. And one of the things that we don't report is that the 1,000 deaths that we have had here in the state of Nevada, CDC's reports was 6% out of the 100% were from COVID, and the other 94% had major underlying conditions that contributed to their death. So what we're telling people is, look, 1,000 people died from COVID, which that's not what the CDC is saying now. The CDC is saying because of their underlying conditions, they died. So I want, as we have our Nevada constituents running around living in fear, I want them to also know the good things about it. People aren't just dying from COVID, right? You know what people are dying from? Not having money from unemployment, right? Kids are getting beat because they don't have an out to get in school. We don't talk about that, right? We don't talk about that at all. We talk about shutting business down, that businesses pay taxes into the unemployment system so then the unemployment people can get their checks. I have a karate instructor in Ward 6 who has not been able to get a check from unemployment. I don't know, what are we on, our 5th unemployment director now? I mean, come on. The first lady that was there, she was just fine. It's not her. It's the system. It's the broken system. And I've been saying this out loud for a really long time. We're looking at testing our homeless. Guess what? Our homeless proves to be the most population with the less positive tests. Our homeless folks don't have COVID. A few of them do, but it's us. It's us germaphobes that all of a sudden that are now exposed to germs that are getting COVID. Our homeless, it's like kids, let them play in dirt, they don't get sick. So I want to make sure that as we go forward as a region, that number one, we're helping our businesses and not punishing our businesses. People are dying without funds. Evictions are going to happen. Our unemployment system is broken, all in the name of COVID. Our kids are getting beat. Domestic violence is up, all in the name of COVID. So at what point is COVID the problem, right? So that's where I stand, and I'm not going to change. Unless we can start getting money to the folks that have been on unemployment since March, and now we're in September, they have no place to go. So this COVID and this testing and shutting our businesses down and, up from Carson City, targeting businesses because of different political affiliations, that's what I'm very frustrated about.
So, Mayor Pro Tem, if I can respond, I will. First and foremost, my hat on the health district is public health, and you sat on that, and our first priority is a public health, that we have to look at public health, right? No matter what it is. I mean, when you're on the health district, it was STDs, it was AIDS, it was infectious disease, it's shots, it's all of those things that we're constantly looking at. I am fortunate that Dr. Legon has been right alongside of us. He also agrees that some of these businesses can open. They can open, and that's why he's part of our regional committee so that we can start moving forward, because there's a mental health component that comes to it as well, right? There is a mental health component for our children so that they have some extracurricular something or another. I personally worked very hard in May to get a lot of kid things open, and I made the argument our children need to have an outlet. We have an outlet for parents, we have an outlet for seniors, but we have no outlet for our children. So first and foremost, we have to do a public health component. For me, my job is trying to balance all the different personalities, all the different political sides to ensure that public health is number one priority. Second priority is economics. So at the end of the day, just like the city, just like the state, just like the county, we're all, our revenue is short, just like our businesses. I can't walk out my front door every morning, my neighbor says to me, my business has been shut down, I can't get through, crazy enough. We gave her a lifeline phone, but not enough minutes to wait on hold at Dieter, so I understand all of those things. But you and I also know the Dieter system was broken in 2009, and it needs to be fixed regardless. And it needs to be fixed today, tomorrow, for the long term. But what I can tell you is we have been following the CDC from day one. We have followed the CDC guidelines, we've followed the CDC guidelines on guidance. That was a driving force on how we did that, and that is what the health district has been filing. The only thing that we have not followed the CDC guidelines on is recent, and that's because the federal government said, hey, we want to give you 60,000 tests because we recognize that Clark County has been footing the bill for all of these tests because of our criteria. We want to give you these 60,000 tests. And as we're standing in a press conference, they're saying something different. But we now have the test, and it would be foolish of us to waste those dollars and those tests. And so we want to utilize them. And it's really an opportunity to help business because so many businesses, as they're trying to stay open or they want to get opened, it was a cost before. It was $138 per test, and this is free so that we can help our businesses test their employees so that when they go home at night, they know that they're not spreading it. But we have learned a lot about the disease since we started this, and if truth be told, our first test was done in January. We had to send it out to the CDC, and we got the results Super Bowl Sunday, right? Chief Steinbeck's first day on the job is the day that we shut down, and he was hired as a fire chief, and he's had this much time to do it. So I understand all of that, but I know that our community wants to get going forward, so we as leaders have to drive the public health component of it, and we have to drive the economic component. That's why I look forward to working with you on how do we do this safely, because the businesses want to do it as well safely, because it's not, they don't want to have 25, 30 people test positive. And the one thing that we've learned, and at least on the health district representatives, and maybe they could give you guys a briefing more often, is that we've learned that, to give you an example, one family of 5, older, husband, wife, child, and then young adult, they all got completely different symptoms, and they all tested positive. So it's unknown, but we have to move forward, and we can do both. We can have public health be a priority so that our hospitals do not get overrun, because that's important to all of us. We have stepped up the staff to ensure the turnaround time makes sense. So right now we have 60,000 tests, and we're going to utilize those 60,000 tests so that it's available for everybody.
So just one more question. So because everything's changing in 5 minutes and fall is coming up, do you think you want to just blow through those 60,000 tests, or do you think you want to save a few for the fall?
No, I do think that we want to use those 60,000 tests because we early on invested for Southern Nevada, and so we have additional other tests that we would have for the fall.
Okay, I just again implore you guys to talk about the positiveness. COVID has basically 6% of the United States folks have died from COVID. 94% have died because they had major underlying conditions. And I think that message has to be told to our people, because COVID is a killer of everything, the economy as well.
Yeah, Council, Mayor, may I
Yes,
answer
please.
a question there too, just a little more? Those 60,000 tests came from Health and Human Services with the staffing to administer them, and they're only here till the 18th, and then they go to another community. So that we have it to use them now or not use them.
Thank you. Thank you. Councilman Knutson.
Thank you, Mayor and Chairwoman. Thank you so much. And Chief Steinbeck, thank you for being here and providing information. I have the opportunity to sit on the Health District with you, and I've participated in many of the MAC calls, so this is not new. And the time and energy that you both have spent on keeping Nevada healthy is appreciated. The question I have for you, Chairwoman, is you mentioned the need for regional collaboration, which I wholeheartedly support. I think the city has been trying. I spend a lot of time with the staff and trying really hard to make sure that we're consistent and compliant with the governor's directives, along with the LEAP committee's recommendations. Going forward, what are your recommendations, and can you be specific and define what exactly our regional collaboration should look like? What do you expect from the city?
So I would at least like to be able to put on our mitigation plan that we are all working together to enforcement. I would like to, as I talked to Chief Steinbeck, is maybe have all our business license folks were meeting for a while, but I don't know that we were putting plans in place. And so what I'd like to be able to do is have webinars so that we could go over the guidance, because I could truly explain it. The LEAP committee is happy to do that. We've been doing that with many of the industry specifics. So our next one is on weddings. What does a wedding look like in today's environment? So we're trying to do that, and if it's helpful for your business folks that we put that together so that we can move forward, we're happy to help. We really need to know what they need, but we need to be consistent. So one example I would give is there is a piece, there's a directive early on, Directive 7, that says absolutely no self-serve at convenience stores. And I argued for convenience stores to stay open because in parts of my district, that is their only source of food. And that is how they eat dinner because there's no grocery store. So I argued to keep them open, but we've learned a lot that maybe they shouldn't, maybe they can open now because we've seen that it works. We've seen through some concessions at polls that it's okay, but it takes a directive change. But at the same time, we have some entities that are finding those folks when it really should be the health district's role to go in because they oversee the food component. So we just have to figure out how to get all that together so that we're not putting unnecessary burdens on business, but at the same time, if you all could tell me what business is seeing, then I can, fight upstream to try and make some changes that make sense.
And Mayor, just one more, and I think from my perspective, I know talking with our staff, I think there is communication between the business licensing folks that maybe doesn't get funneled up. And so if we're able to document how the staffs of each respective organizations are working together and share that, I think it'd be useful. And as far as the fight for keeping the economy alive, I think I would like to partner with you on doing that, and I'm sure everyone up here would like to partner with you on that. It shouldn't just be you shouldering the burden of fighting for Southern Nevada.
Well, maybe me or you and I could write a letter to give to our mitigation packet tonight so that we can, and I can get one from the Henderson as well to say we're all working together.
Madam Chairman, knowing that you have your panel of commissioners, and sometimes they're not always on the same page, we have to make very sure here together that we all espouse the same and don't go off on our own. One saying, I disagree with this, and the other one, I disagree. We've got to get everything, your panel, our panel, and realizing too, regardless of what we have tried, through whatever avenue we've been able to work, always as suggestions, because we realize and have learned from experience over 5 months that we are just one entity and the buck stops at the governor's desk. And as it changes so often, that we have to be able to fluctuate and work with that, knowing how LEAP came about. And we know we have the mitigation community up at the top with Caleb Cage advising everything has to funnel through into the funnel to get to the governor. And so as he varies his decisions or loosens something or tightens something down, which can happen in a press conference, in a 24-hour or 12-hour period, it makes the consistency and the communication on a regular basis very challenging. And so the bigger the group, the more input we have, each group has to have itself together first. And I say that because I know we can have different council persons speak out personally on what they believe, but it may not be the consensus of the whole council. Because we know with how COVID's being treated and what's been happening in this state, which is unique from any other state in the country because of our dependence on the convention business and tourism, that we are unique. We are one of a kind here. And so working with staff and having our council in open communication with staff as well, and not just go off individually to be able to communicate on behalf of the whole. That doesn't work. It creates more confusion, which will be for you. So to me, appreciating everything, and I want to hear and give the opportunity to Councilwoman Diaz, because you spoke so eloquently eloquently of what's been working in the Latino community. It is critical that we have a plan, and how that plan, and since you are the most gracious and knowledgeable because of your experience and government experience in particular, what is that plan? And as you articulate it and get it down and get the input from others that you would want that from, how can you be assured it can move with the flow of the chief executive of this state that has been moving forward how this is treated with no input from the grassroots, no input from anyone but his selected members, and also with special sessions, which you have sat through so many over your lifetime. So we need a plan, we need one that's really variable, and we want to make sure that no one person is speaking out on behalf of a whole body unless they have that suggested open communication to do so. So it's a plan, and one that allows this variability. And because of your experience, as you start to pull together all these pieces with which you've been working, I think it makes excellent sense. So Councilwoman Diaz, please.
Thank you, Madam Mayor, and I want to thank Commissioner Weekly for coming on down to our chambers today, and also Chief Steinbeck. I hear you quite often on the MAC calls, and thank you for your diligence in making sure that the access to testing has improved over time, and it's making a difference. We can see it in our positivity rates. And of course, Chairwoman Kirkpatrick, your leadership in this area is so much appreciated. We worked in the legislature together. We spent many long nights working on policy, and we know that it truly takes a village. It truly takes every member of the community to get to a point where we can see ourselves prospering. And we were in this very difficult place back in 2011 when I first arrived in the legislature, where we had to cut and cut and cut out of our budget because we were going through that recession. I know you know firsthand the detriment to the economy and what the impact will be to our community if we don't correct the course, if we don't do everything in our power to get that economy and that engine going again. And I know that's why you're staying up every night. I appreciate every opportunity that you've afforded me to be part of the work. I know that we've been able to come together and try to articulate to our community why it's important to get tested, whether you're symptomatic or not, because we know 40% or so of cases are asymptomatic. People have it, they just don't know they have it, and they continue to go to work and they continue to interact with family around them, and that contributes to the spread. And that's why it's so easy to wear a face mask and help us lower that 13% back to 5%. That's what I think we need to get back to, keeping in mind that we want the rates to get to 5% so that we can reopen, because of all of the comments that have been made here at the dais. I mean, we're all feeling the same frustration, the same pain, the same worry, the same concern, and I'm hearing it now through our Fremont Street experience. Casino operators, they're saying, you know what, science is science. Let's put the politics aside and let's do what's best for our people. And what's best for our people is for all of us to be working in harmony and synchrony so that we can get these rates down, so that we can continue to reopen and maintain Vegas as a gold standard tourist destination, but not just with that in mind, but also be a gold standard for our community, because we're keeping their health and safety at the forefront of every decision we're making. And I know that that's where you're coming from today. You're coming from a place where your heart is in it for our community's safety and well-being, and also our business sector's health and prosperity, so that they can bounce back. Because the more we're lingering in this, we can't reopen phase, that hurts. And we are very, very concerned about how many people will be able to bounce back and reopen their doors. And I remain committed to staying the course, doing whatever I can as a sitting councilwoman or representative, but more so a Las Vegan, that I think we're through and through, and we really do want to see our people in a better place. And I'm right there with you. Let us know how we can continue to help so we can get our economy back on track.
Okay, thank you, and I appreciate all the work. So you know that it's not just her district. So we've learned out in Bunkerville that there's a large Hispanic population. We learned at 89108 there's a population. We learned everywhere. So it's been hard work. But I mean, this is great. I appreciate us continuing to work together more so than ever. And we are a strong community, and we are the lifeline for the whole state. And I think that speaks volumes. And we have many, many businesses that want to be able to move forward, but there are bad actors. Don't forget, there's some bad actors out there, and they should be penalized, not the people that are doing well. So we're happy once a week at 5 o'clock, we submit the mitigation conversation to the state. So that'll be tomorrow's conversation. We're happy to include you, Mayor, or a designee in that conversation of what that looks like before we get to that point, because we do have UMC, we have Southern Nevada Health District, and we kind of try to walk through where's the movement this week. There has to be some movement. I feel like there's a big steam going in, and we have to lift the valve like an old pressure cooker so people can take a breath and we can move forward.
24/7, I sleep with my phone. I'm as far away as that, and being elected at large, I think it would be absolutely appropriate. I work with all the entities that you mentioned as well, and just know that we get the calls in City Hall, in the mayor's office from around the world, because the name Las Vegas is known everywhere. And so representing whatever I can do at any time, ride-alongs, but you go so far-reaching, I can't believe your ride-alongs, but we thank you so much for this and for being so significant in trying to make this a better place at this time and always. And, sir, appreciate everything that you're doing. It is something that we will overcome.
Yes, ma'am.
And we will hang in there. So thank you. I
We're
have
almost
my
there.
reading.
We're almost there. I know it.
Okay.
All right, thank you.
Thank you. Our best to the commissioners as well, and thank them
Commissioner
for our
Weekly should have
support.
done a good job chairing the
Thank
zoning
you.
meeting.
You
So.
have a great team there. Thank you.
All right, thank you.
Thank
Have a
Thank you
great
very
day.
much.
Okay, now what I failed to do in the public comment was turn this over to our city clerk to talk about how e-comments can work with us here at the council meeting. So, Ms. Holmes, please.
Thank you, Mayor. Viewers can follow along with the meeting by watching our live stream on KCLV Channel 2 on